I wanted to review the most recent laboratory study. This concerns the Vectra level. The Vectra level was developed by Crescendo Biosciences, a multi-biomarker blood test for assessing rheumatoid arthritis or inflammatory arthritis disease activity in patients treated with DMARDs and biologic drugs. It can also give us a starting point from which to determine the level of disease activity. The Vectra assembles a panel of 12 key proteins that have been associated with rheumatoid arthritis into one test, which produces an objective quantitative score related to disease activity. The score is from 0 to 100. The lower score indicates less disease activity and helps doctors and patients make treatment decisions as they go forward. Interpreting the score is essential. 45 to 100 indicates a high level of disease activity, 30 to 44 indicates moderate disease activity, and 1 to 29 indicates low disease activity. It is not used for the diagnosis of rheumatoid arthritis, but to assess disease activity. The level of the score can help with predicting possible radiological progression, that is a percentage, or joint damage with rheumatoid arthritis following the degree of disease activity. Low disease activity less than 29, it's 0. Moderate disease activity 30 to 44, it's 3.4. High disease activity, it's greater than 44. We have a 20.9. Your disease activity was moderate. If the joint swelling and stiffness persist, we may need to consider additional medications called DMARDs. Disease-modifying anti-rheumatic drugs, or DMARDs, include medications that slow the progression of joint damages from rheumatoid arthritis or inflammatory arthritis. These drugs are called disease-modifying rheumatic disease drugs, and they are important in the overall treatment plan. They act on the immune system to slow the progression of rheumatoid arthritis. That is why they're called disease-modifying agents. Many different drugs can be used as DMARDs in the treatment of RA, but some are used more than others. The 5 medications include Plaquenil, Sulfasalazine, methotrexate, and Areva. We explain each one of these except for monocycline, which we use later. Plaquenil is an anti-malarial drug. It's used for mild rheumatoid arthritis. It's not as powerful as the other DMARDs, and it usually causes fewer side effects. In rare cases, Plaquenil can adversely affect the eyes, and patients taking this medication should be seen by an ophthalmologist at least once a year. Sulfasalazine is another disease-modifying agent. It decreases pain and swelling of arthritis, prevents joint damage, and reduces the risk of long-term disability. It's a type of sulfa drug, and if you have sulfa allergies, you should not take it. Most patients can take it without side effects, but the most common side effect is nausea and abdominal distress. Methotrexate is the third commonly used DMARD. This is because it has been shown to work better than any other single medicine. It can cause rash and skin upset, and it causes birth defects. Regular blood work is necessary when taking methotrexate. Taking folic acid helps reduce some of the side effects. Its dosage is 7.5 to 10 milligrams each week. Actually, it's 15 milligrams each week. It can be taken 3 to 6 weeks. Leflunomide is another medication. Like methotrexate, can work well and better with combination. The side effects are similar to methotrexate, and sometimes diarrhea. It's taken as a 20 milligram tablet once a day. Sometimes we have to do 10 milligrams. Blood tests and TB and hepatitis. Now, my suspicion is that you have inflammatory arthritis. This is a grouping of the types of arthritis involving the immune system. In autoimmune disorders, the body sends errant messages to cells with immune function, including white blood cells, instructing them to attack the body's own tissues. The damaged tissues cause deformity, instability, and scarring within the joint. These diseases are characterized by the presence of white blood cells in the joint. One of the most common types of inflammatory arthritis is rheumatoid arthritis, affecting 1 to 2 million Americans. Rheumatoid arthritis is a chronic inflammatory disease that affects the synovial lining between the joints and can lead to severe pain and loss of function. Thank you.